So there's been some breakthrough news with acupuncture, medicine, and all types of information about your health. Okay, so my name is Fitz. I'm an acupuncture physician out of Miami, Florida, and I try to bring you the latest acupuncture news and just overall health news on this channel. But like I always said, this video is for educational purposes only. I'm an acupuncture physician. I'm not your physician, so always check with your physician for any questions about your health. So, did you know that is good for a lot of health issues? The list goes on: headaches, migraines, sciatica pain, low back pain, generalized pain, infertility, insomnia, digestive issues, menstrual issues, low bone density, insomnia, stress, anxiety. The list goes on and on and on. But acupuncture is also good for PTSD. Yes, PTSD. Let me explain. Unfortunately, a whole bunch of our veterans and soldiers suffer from PTSD, okay, post-traumatic stress syndrome, and that can cause all type of issues, sleeping issues, and just a high alert of stress all the time. Acupuncture in research has been shown to help veterans or people suffering from PTSD, and there's certain acupuncture points that's been proven in research to show actually brings down inflammation. When it comes to inflammation of the body, inflammation is the reason sometimes PTSD is prolonged. If we're able to bring down the inflammation markers and bring down inflammation, it can help people with PTSD. There's a cell in our body called the T regulatory cells. It's part of the immune system. Now, these cells keep our immune system at bay. If we have a low amount of T regulatory cells, then you're more prone to autoimmune disease. And research shows that people who suffer from PTSD have a significantly lower T regulatory cell count than regular people. T regulatory cells, or TREGs, TREGs, are lower in people suffering from PTSD. Acupuncture point stomach 36 can help regulate the TREGs, or T regulatory cells. That's just one of the breakthroughs that acupuncture is been shown to have effect. And I try to tell people this message all the time. I think everyone should incorporate acupuncture into their daily health health rituals, you could say. If you go to the doctor, always go, okay, I want to be very clear, always go with your regular doctor first for any health issues, right? But sometimes medical doctors need help. They do an excellent job, but in some cases or some conditions, they just can't quite figure it out. That's why acupuncture can be complementary, or just overall be a better option for some people with certain health conditions. For instance, let's say skin issues. Some people get skin issues. It could be acne, psoriasis, allergic reaction. Yes, Western medicine can do a wonderful job in controlling them with certain medication, ointments, and whatsoever. But sometimes a medical doctor doesn't have the answer of why a person is breaking out with some type of rash. Whereas acupuncture physicians like myself, we view the body differently. We have a different reason why people can have rash on the body. For instance, if you have rash on the body, we usually call that a heat pattern. If there's blisters on it, or blisters with the rash, then we call that damp heat. And there's certain Chinese formulas to help get rid of the excess heat or damp heat. Acupuncture is more than just putting needles on people's back. Acupuncture has been around for about 5,000 years. It's been proven over and over again. And that's why I'm so happy that at least these days, acupuncture is being more incorporated into regular medicine. And by regular medicine, I mean Western medicine. Because we're not here to compete against medical doctors. We're here to help or assist if needed with medical doctors. Because at the end of the day, the goal for me as an acupuncture physician or for the medical doctor or specialist is to make sure the patient gets the best care possible. But I seriously think part of getting the best care possible in a lot of cases is having acupuncture on board. Acupuncture is great for pain, especially post-surgical pain, because certain drugs or pain medication can be addictive. But with acupuncture, we can control the pain without any drugs, just with acupuncture needles. And I'm not just saying this out of thin air. This is proven in research that certain acupuncture points releases endorphins, releases certain neurotransmitters, releases stuff in our brain that makes us block pain or feel good or feel less depressed. Sometimes people ask me, do needles hurt? Acupuncture needles do not hurt. It should not hurt. Some points may be more intense than others, but acupuncture needles do not hurt. I put needles in my face sometimes. I get acupuncture done sometimes. Acupuncture is not anything to be afraid of or scared of. Oh my gosh. Because at the end of the day, this is your health we're talking about. This is your health. Your health is more important than you being scared of needles. And don't think about it as needles. Our needles are not like regular needles. Regular needles are much thicker because stuff goes through them, like blood or drugs or fluid. Our needles are super thin. They're not hollow. They have no hub. So there's no reason to be afraid of acupuncture needles. They're super thin, as thin as your hair. Acupuncture is also good for infertility. Infertility, y'all. Now, with infertility, it usually takes a specialist along with acupuncturists to figure out the best plan for the soon-to-be parents. So when I say acupuncture is good for infertility, I'm not saying if you're infertile for whatever reason and you get acupuncture done, boom, you're fixed. No. With infertility, it's a process. There's no 1 week of treatment and then you're good. No. So, but the point is, acupuncture can assist couples in having a baby. So that's a good point about it. There's a whole bunch of myths about acupuncture, and I try to debunk these myths as much as possible. Okay? And acupuncture is not hocus pocus medicine. It's not make up believe medicine. This is real medicine. Let's try it over and over again. It's been around for thousands of years. That means it has to work. The way it works is that our body is full of acupuncture points. These points are along channels or meridians. Most of the meridians are named after organs, and the organs are paired up. So your stomach channel and your spleen channel are paired up. Your large intestinal channel and your lung channel are paired up. Your heart channel and your small intestinal channel are paired up. Your gallbladder and liver are paired up. And by channel, those are most on the surface. We also have inner channels, kind of like divergent channels and other channels. But the main ones that we use for acupuncture points, that's the one I'm talking about mostly. My thing is, don't wait, okay? Acupuncture can also treat depression. And when I say treat depression, it can manage depression. We don't say cure. In the acupuncture world, we don't say cure, so I'm not saying cure. It just can help manage depression, anxiety. There are key points. For instance, there's a point called PC6, pericardium 6. If you take your 2 fingers and put it right here, right by your wrist, it's between the tendons. That's called PC6. That point is good for digestion, good for heart issues, but also good for anxiety or depression. There's a point between our pointer finger and our thumb. The webbing is called LI4 or large intestinal 4. We call it the aspirin point because that point is good for headaches and stuff. But I don't recommend doing these points if you are pregnant. And again, this video is for educational purposes only. I am an acupuncture physician, but I'm not your acupuncture physician. So if you have any questions about your health, about medicine, always talk to your primary doctor first. They can immediately help you. And hopefully in some cases, they will refer you to an acupuncturist where we can take over or assist them in whatever they need. Please, if you have any comments or questions, leave it below and I'll try my best to answer them. Okay? Until next time.